praying their Fajr namaz. And it's a glorious, beautiful, sunny morning in Leicester. It's a great atmosphere on the streets out there. Even last night while I was out, there was people who were actually, delivering iftari to different houses. There were samosas going in one direction, fresh fruit going in another direction. I was hoping I was more on the side of getting the samosas, though, being honest. So I'm more partial to those, especially during Ramadan. But you're listening to 87.7 FM Radio Ramadan. We're talking about foster caring. So if you have any questions about foster caring, this is a fantastic opportunity to ask any questions or any information you wanted to know about foster caring. I know it's a subject that we don't really talk about a lot, but we do need to talk about it. It is very important and can make huge differences to people's lives. It does make a significant difference to the children who are foster cared. You're listening to Radio Ramadan on 87.7 FM. The studio landline number is 0116 4822 086. Or you can send us a WhatsApp message. If you're shy about calling in, you can always send us a message, 077 488 55055. We will also, towards the end of the show, be talking about ADHD and issues relating to ADHD. So take the opportunity. We have one of the top consultants in Leicester and Leicestershire with us this morning. So we'll be able to talk about any issues that you might have in the area of mental health, just generally for children, and any issues that you might be facing, and he will be able to offer you some advice. We're going to go to our first guest, and thank you very much. It's Susanna Akhtar, who's a foster carer. Susanna, thank you very much for coming in.
Thank you.
And thank you also, Dr. Abby Rator, who's a consultant in children's what is it? Children's.
So, good afternoon, Zafar. First of all, a happy month of Ramadan to everybody, and especially to ones who are fasting. So I'm a consultant in child and adolescent psychiatry working for the LPT, Leicestershire Partnership Trust, and the service is called Child and Adolescent Mental Health Service, CAMS.
CAMS, yeah. So it's the CAMS I know that abbreviation, but I never knew what it stood for. So it's Children,
Adolescents Mental Health
So
Service.
it basically covers a whole range of mental health issues for younger people, basically.
Yes, up to 18.
Up to 18.
Yeah.
Okay, excellent. So first of all, I'm going to start with you, Susanna. What is foster caring?
So firstly, good afternoon everyone, and Assalamu alaikum and Ramadan Mubarak to you all. Hope this blessed month is going well for you all. In terms of a foster carer, for myself, I'm employed by the local authority, and it's where an individual offers a loving, caring and nurturing home to babies and children within the local authority's care, and to provide them a placement and a place to stay in their time of need. Hence, fostering involves looking after babies and children, which can vary in time scales depending on the needs and the requirements of the individual cases. There's various types of fostering. These can range from short breaks, looking after children for a couple of days to give carers a break, or maybe children with special educational needs, short-term fostering, long-term fostering, and respite. So there's many ways of coming into fostering, and you can slowly wean yourself in as well by perhaps taking the short breaks or the respite as initial introduction to the fostering career, and then slowly building on that, where you can do short-term and even long-term, which can go from days to months to even years for children.
Excellent, thank you. I'm also going to bring David Thrussell in. David is the head of service at Leicester City Council, head of corporate parenting. Morning, David. Welcome to the Radio Ramadan.
Good morning, and thank you for the invitation onto the programme this afternoon, and happy Ramadan.
Thank you, David. Now, one of the questions that we've already got come in is, when you say short and long term, so you mean that somebody could do it for a few days and just try it effectively as foster caring? Yes, sorry, David. Yeah, that's for you. Yep.
That's fine, thank you. With short-term fostering, we talk there about the actual time that the child will be living with the family, as opposed to from the foster carer's point of view. So with all our foster carers, there's a standard training program. Once they identify that they want to get involved in fostering, and there's quite a comprehensive package of training and support. And then once the term we use is foster carers complete that training, they're approved, then they can identify
Thank you, David. That's a great answer. Thank you. Susanna, why did you get involved and how did it start?
I think my route into fostering might not be the standard route for many in terms of when I was 8 years old, both my parents became approved foster carers for the local authority. So I pretty much spent most of my childhood within a fostering environment. Clearly this had a positive impact on me and encouraged me to want to become a foster carer in the future.
So your mother and father started foster caring?
That's correct, yeah.
Yeah. And how many of you were there already?
Well, I'm from a big family. I was the youngest of 9 children, to be honest.
So there was 9 children already, and they wanted to foster care even more children.
I think they seen an advert on the TV back in the day, and it was it touched their hearts really, and they felt that there was a need to want to support these individuals. They had the capacity, believe it or not, still, and they
and
went
the passion
ahead.
and the drive really to
Definitely,
do that.
yeah. So
And do you see some of those foster children as you're out and about, and how do they? Because you obviously grew up with some of them.
definitely, yeah. And I've got to say, my parents have been very fortunate in terms of a lot of the children they've cared who are now, as you say, grown adults, and they have maintained contact with ourselves and still value that time of us being there in their time of need. And it's really nice to maintain a positive relationship with them and know you had that impact on them.
So they're probably grown up adults now, and they still remember your mum and dad and probably treat them as they're their mum and dads.
Very much so. I mean, some children have gone back to birth family, some children haven't. Every case is different, but they have always maintained relationships. Some have even gone on to be adopted and come return with their adoptive parents. And, but they are very valued of the time that my parents accommodated them and supported them. And so that's really rewarding in itself, and definitely one of the positives of a fostering role.
Yeah, and one of the question is that, how many children did they foster care for during their lifetimes, do you think?
My mum still is fostering. Unfortunately, my dad passed away. My mum's still fostering till today. She does have children still in her care. But within that time, I think there must have been done a good 35, 40 children, bearing in mind that a lot of their children have been longer placements as well, and a lot of them have gone on to adoption and when they did babies, so they've had a varying scale really from babies through to teenagers throughout their career of fostering.
Sorry, David, I just want to bring you in. Is this quite common? Lots of people sort of fostering as many children? Yeah.
Definitely.
Yeah. Yeah, so basically what it sounds like is if you love parenting and you love being a parent, this is the opportunity to actually carry on parenting skills even when your children have grown up and moved away, and you've got the opportunity to actually bring up other children as well. And it sounds fantastic, and I think your mum and dad probably really enjoyed by the sound
Definitely.
of things.
I mean, a lot of our siblings have grown up and moved on and left the nest, as you'd say, but for my parents it's carried on still a number of years beyond us going, and grandchildren coming into the family and even great grandchildren, but they've still maintained the fostering role of supporting these other children and bringing them as to be part of our family as well.
So you're part of a massive family now, aren't you?
We definitely are.
Yeah.
And we go worldwide. Children we've looked after have gone as far as India, Portugal and where else. So, and those links have still maintained, which is lovely.
It is fantastic. It really is. That's a huge positive. What is, apart from the sort of the rewards that you get, obviously, is there any allowance and is there any support from the council or pay that's given to support these children while they're in foster care to the families that are involved? David?
Yeah, sure. So there is the answer, and there's what we call an accreditation fee once somebody's completed their training and is ready to start fostering. The child will be placed with them, and that's a standard fee. And then in addition to that, there's a weekly payment, and that might be something in the range, taking the range up to between about 220 to up to about £300 a week for a child. That will then alter depending on the child's age. So obviously, we do look after younger children, and we also look after teenagers and adolescents. So we look after children of all ages from 0 to 18. So there's a scale of payments depending on the child's age. But yes, there's an accreditation fee and a weekly payment. Then on top of that, we provide additional support for holidays, for birthdays, and significant festivals. So yeah, all that would be discussed at the time that it comes forward and wanted to sort of find out more about what fostering might mean for them in terms of the opportunities and the support that they will receive as foster carers. I think alongside that, really important to say as well is about the peer support from other foster carers and a whole lot of training that we can provide for the council for people when they first start out fostering on that journey. They might have a few more anxieties, and want a little bit more support, and to make sure that we can be there when those difficult conversations need to be had or support and advice needs to be made available.
And Leicester is a super diverse city, David. It's got the mega diverse city that you can have in the UK from all different backgrounds, and you must have children coming in from all different backgrounds. Do you actually have enough foster carers? And does it actually? It must be far better to try and place them with people with a similar background, surely.
Absolutely right. So whilst as I say, more than 2/3 of our children living within foster care households and families, and we're very proud of that, we would want more of our children to be able to live locally with families. And you're absolutely right. We would like to get more foster carers to live all of our community, diverse communities across the city, and such a fantastic place to live and to work and to go to school. And as a result of that, we're really keen to get out the positive messages that fostering opportunities provide across all communities. And it's really important that when children become looked after, that we do everything we can to make sure that they're what we refer to as they're appropriately matched to meet their religious, their cultural needs, their age and circumstances, and other children might also be in the households. On the basis, don't forget that many of our foster carers have children of their own, so these children will be joining a larger family. So it's really important that we think about what's the best match for those children. And as a consequence of that, we absolutely would want to encourage more families to put themselves forward as foster care households across the whole city.
Excellent. Thank you very much, David. You're listening to Radio Ramadan on 87.7 FM. If you've got any questions, you can call in the studio phone number, which is 0116 4822 or you can send us a WhatsApp message on 077 488 55055. So, Suzanne, there's lots of rewards for doing this. What's the most rewarding thing that you find about it? Because you're getting a reasonable amount of pay to do this. You've got the children. I mean, it's amazing, really, when you think about it. But what makes it special for you?
I think fostering, you've got to have a passion for it. You've got to have, that interest in wanting to make a difference to a life. And for me, the biggest difference, reward for fostering is to make that positive difference to someone's life. When we've had children come into our care and see a child who has been quite quiet, confused, nervous, reserved, and then be able to build that relationship to see that child leave you flourished, confident, happy, smiling, and, you know, building their individual self and identity. I think there's nobody can buy that for you. And that has definitely been a reward for me for fostering. And following on from what David was saying earlier about the cultural needs and trying to get the cultural match, the local authority will definitely try their best to put children in culturally matched placements. But as a carer, Muslim carer myself, caring for children, we know sometimes there is a shortage of Muslim foster carers out there as well. And I've actually done respite for children who were as young as 3 and 5 who came to me up for a respite placement. They unfortunately couldn't get a Muslim match for those particular children. But when they came to our house, simple things such as saying Assalamu alaikum on the entry to the house, you know, seeing the water lota in the bathroom to wash themselves with. It was shocking at how these little things, which me perhaps obliviously don't take no notice of, these children were spelling it out to us, oh, we used to have that in our parents' home. And it highlighted to you how much important the culture is for them to feel at home, to feel at ease. And, you know, I think even that made us feel that, you know, you don't realise subconsciously how much you are welcoming these children if they can get the right match and, you know, easing their worries in their time of difficulty and need, really.
And it's really important, actually, when you think about it. It's actually not just giving them a place to stay. It's giving them the whole family atmosphere and be able to comfort them and bring them out of their shell. And you know, there is a shortage of foster carers out there. So if anybody's listening and is interested, please contact Leicester City Council. You can contact if you go online, there's plenty of information. I'm sure David will be able to tell us that. But from any community, I mean, Leicester's a super diverse city. From any community, there is shortages across the board, I'm sure. You know, you need to reach out and say, look, you know, please consider if you love being a parent, as one of the things I love being as a father, I love being a dad. You know, it is one of the best things in my life that I treasure, and it's really a great opportunity to reach out and make a difference, a real difference of helping lots of young children across the board. You know, just imagine having links with 35, 40 children across the city. It'd be fantastic, absolutely fantastic. David, I know you wanted to come in here. So, what do you think? Go on, carry on. Yeah. Just repeat that again, David. Just repeat that number again, please. Excellent. Thank you, David. Thank you for all that information. If just Google fostering Leicester and it should come up and you'll get all the information. Please join in and try and you know, talk to other people, because there might be friends and family that you might know that might be interested in doing something. And it's hugely rewarding. What are the challenges though, Susanna? What are the challenges sometimes you face with dealing with
I think for many
fostering?
people, they'll see the initial assessment process of fostering as a challenge, and hence often puts a lot of people off the first step of even coming into fostering. However, myself, I've got to say I didn't perceive it that way at all, and maybe that helped because I was in the line of being grown up in the fostering environment to see it, through a different lens. But I mean, I think personally, if we look through it through the right lens and we can understand why we need to be open and transparent for this initial assessment phase and how it is to the benefit of all, it makes this process a lot easier for ourselves as individuals to proceed through it. And often the supervising social workers...
But once you've got started,
Yeah.
once you're accredited, you're away on.
You're on your way, definitely.
You're on your way.
And the supervising social workers who are putting you through this initial assessment are aware of touching on areas that could be sensitive to yourself, and will very often put you at ease and make it a comfortable journey for you. So,
But they've got to do their job.
Yeah, definitely.
They've got to. The children's safety is the paramount issue.
Definitely, yeah. And it's a duty that we all maintain that at all times. In terms of the fostering role itself, I'm not going to lie. Undoubtedly, there are some challenges. We're dealing with children. We've got to remember we are dealing with children who have faced trauma in some form or another. And this inevitably will impact on the child's behaviour, their emotions, the way they present themselves. But this is not to say that we cannot manage this, even as individuals, if we start looking through the lens of the child and understanding why they behave the way they do. This really helps to put fostering into context and help you to support the children better. Like David says, there's a lot of training offered by fostering, which can support you with this, and also there's a lot of external agencies, like we've said, CAMS and others, who can also help to understand the child better and give you techniques and strategies on how to support them in their time of difficulty.
And the rewards must be massive when you change that person's life.
Definitely. And, when you can hit the nail on the head and actually notice this is what works for them, and you will see a complete different child, it is very rewarding to be able to kind of help them to come out their shell, or help them to be able to communicate, which they struggled with, and, to deal with situations. So
I know Abby wants to come in on this. So, Abby?
I just wanted to sort of acknowledge the huge amount of work the colleagues who are into the adoption and fostering do. But just on the point of the challenges, wanted to sort of, from the mental health perspective, what Susanna just mentioned, remember some of these kids are coming from a lot of places where they've had difficulties. You can name them in terms of attachment, or trauma, or moving through different families already. So the chance of these kids having some mental health difficulties is higher than normal population. And as Susanna was saying, if you are able to give them a much more secure base where they are able to manage and stay, it gives them a much better chance in life. And then there are different services, like mentioned that there is a supervising social worker who helps in you to navigate through the process. And then as I'm from LPT, within the CAM service, mental health services for young people, there is a team dedicated especially for these young people who might have this kind of difficulties.
And really, it's opened my eyes, and I'm sure it's opened lots of people who are listening to this eyes, because we didn't know this service existed in the way it does, and the amount of children going through it. And really, I wanted to say thank you, David and Suzanne, and for the rest of the foster carers out there who are listening to this, because you've really paid back into society, make a real difference.
Absolutely.
Because otherwise, these children would probably struggle.
Oh yes,
hugely, and you that element of support that you give them is making life changing. Life changing for them.
The whole trajectory of their life can change if they get into a much more comfortable and secure sort of family environment. Otherwise, as I've already said, the chance of some of these kids having mental difficulties is very high. But they can sort of settle down into the families, and then that sort of helps them to make good bonds, secure attachments, and then it makes them sort of feel much better amongst themselves.
Yeah, so we've got a message coming in. What about Oadby and Wixton Council? Oadby and Wixton Council is a borough, so it would actually come under Leicestershire County Council, which is the unitary authority. So if you wanted to look at fostering in Oadby and Wixton, you would be contacting Leicestershire County Council, and if you go to fostering Leicestershire County Council, I'm sure lots of stuff will come up on that. And also, I think, am I right in saying, David, that you would take children into the county? Is that correct?
That's right. Yeah. I mean, there's no geographical barrier, so we have foster carers working for us and looking after
children who actually do live in the county. So if it was an OB Wigston or a county-wide inquiry, they're still welcome to make that inquiry to the City Council.
So wherever you live, Leicester City Council would be the person, people to approach, and we just hear such good things about, I mean, Susanna, and I've had a couple of messages from different foster carers who've been foster caring for 10, 11 years and say how rewarding it really, really is. And one of the things that we all need to remember is, little things make a huge, huge difference. And this is actually quite a major thing, and it makes an even bigger difference for those children and the outcomes of all our futures, because they are the next generation. We need to look after all of the children that live in not only the city, but the county, but this country. And those little things do make a huge amount of difference. And it's really, please, David, pass on to all the teams and all the foster carers our thanks for their hard work and the dedication they do in making sure they bring these children up in the best possible environment they can find. And it really does make a difference.
Well, thank you for those comments. That they are much appreciated, and you're absolutely right. We're very much about celebrating our children. They are our children in the city, and that concept of corporate parenting, and it's in everyone's interest that we provide the best home and the best start for these children. And that's very much is what our foster carers do, day in, day out, and that very much can be unsung heroes. So thank you for the opportunity today to be able to shine a light perhaps on some of the fantastic work that our foster carers do every day.
No, thank you, David. And I just wanted to say, Leicester's a great city of celebration. We always like to celebrate something. So when you get any milestones in the future, let's have a big celebration and celebrate the contribution of foster carers, because, they're unsung heroes across the city. We wouldn't know who they were. I would walk past Susanna. I know Susanna. And I wouldn't know of the incredible work that they do, and they need to be recognised at some point, David. More than happy to help, and I think lots of people would be out there would be happy to help, but we need to celebrate the successful fostering services that we have in our city and our county.
Thank you for those comments. They're much appreciated.
Now we go on to Abe. Abe is a CAMS consultant in mental health services. Abe, ADHD, there is issues. People are struggling for diagnosis, and how long is the waiting list, and what's happening out there with children who have ADHD now?
The recognition of this condition has grown exponentially in the last few years, and that has led to people asking for assessments, and that's the reason the waiting lists are very high.
So does that mean it was around before, and now all of a sudden people have thought, oh, I keep hearing this word, maybe it's ADHD, let me get a referral, go to the GP and get a referral, and that's basically what's happening at the moment? That's
correct. So the diagnosis of ADHD has been around for a long period of time, but in the last sort of 5-10 years, the recognition about the condition has gone up, and that's why the awareness has gone up. The social media has played a significant part in there, and if I may say, a slight sort of reduction in stigma has worked in a way that people feel comfortable to ask for that and look at that might be a potential problem of my behavior, and if I get assessment, that might help me solve the problem. So it's worked well, but that has sort of pushed the waiting list very high.
It's I'm just going to come back to it. We've got another message coming through on text message. Hi, I'm an ex-foster carer of 12 years and have had over 100 children through my doors. A friend of Zafar's too, happy to talk if you need a caller to share my experiences, was motivated initially due to the shortage of Muslim carers. Biggest example for the Muslim community is that the Prophet Muhammad sallallahu alaihi wasallam was technically fostered by Halima, and may Allah be pleased with her. So actually, it goes back centuries being foster carers, mashallah. So that's a great bit of information. Thank you, I know Charlie for that bit of information. Absolutely fantastic. Abi, you were saying ADHD, and the fact that actually it's no longer a stigma. It's no longer seen as a negative. People have sort of gone past that, which is a great achievement in itself.
Yes.
To say actually, my child might have ADHD. What can I do about it? How can I make it easier and better?
Yeah, absolutely. And I think that's the reason. A slight sort of word of caution on that one, if I may, that as the awareness for ADHD has increased, so has a lot of kind of self-help stroke, self sort of referral, etc. available on the internet. So I just wanted to let people...
Word of caution.
Word of caution that there are lots of places where you can get the assessment. Because of the long waiting list, people sometimes go to private providers. But people need to be mindful that they need to go to a reputable place. The ADHD assessment can take sometimes 2 to 3 hours. And it needs an assessment where we get the information not only from the young person, but the family, and then the information from school. Because it's the pervasiveness of the symptoms, that the symptoms are present not only in the home environment, but also in the school environment and other places. And for that information gathering takes time. So just be mindful that you get that assessment done through a proper and a reputable place. And remember that sometimes people get into this muddle that they go for a private assessment, but the report is not of a decent quality. Because if you come back to NHS, or if you go somewhere else, that report needs to be credible enough to get you some help. And the other element that people sometimes don't realize is the prescription, the medication. Not a lot of services who offer the ADHD assessment then take further treatment or the prescription option as well. So just to be make people aware of that.
So you need to make sure that you go to the proper accredited
Yes.
people
Yes.
who can diagnose and support.
Yes.
If you don't, you're ending up actually wasting time and wasting money as well.
Yes. Yes. And you need to
Unfortunately.
remember that it's a
And
detailed
do you
assessment.
feel that people are taking advantage of the situation as well?
I think there are lots and lots of these assessments being offered online. And we need to be very mindful before we make that decision in terms of how do we check the reputability of those places that we put our money to.
And you know, as consultants, do people come to you and say, "Oh, can you recommend somebody?" Or because there is a long waiting list, and is that situation going to actually improve? Because parents, obviously, when they're worried about their children, they're going to think, "Oh, we need to be doing more. What can we do?"
Yeah.
And they're in that catch-22 situation where if the NHS is struggling with their waiting list, they're tempted to go elsewhere, and I think that's the issue for them.
And I think that's a genuine problem. And I think in terms of the service provision, we would love to be able to help everybody who's taking that sort of request. But unfortunately, because of the limitation of the resources, despite pushing through the numbers as much as we can and trying to sort of improve the efficiencies, there is still a significant sort of waiting list. While we have to sort of manage and support the new assessments, the patients that are already on our books, they need some help, and we need to sort of look after the emergencies that present to us on a day-to-day basis. In terms of the recommendations, I wouldn't be able to make any specific recommendations, but just that word of caution that when you look for some help online, be very careful and ask appropriate questions, that you get a detailed, thorough assessment report written, and what are the sort of aftercare arrangements before you commit to spending your money.
Yes, and you're listening to Radio Ramadan on 87.7 FM. If you've got any questions, telephone number is 0116 4822 or you can send a text message on 077 488 55055. And do you find that it disproportionately affects any particular community from the ethnic minorities? Is it one that affects any particular community more than so?
I wouldn't specifically say for the ethnic minority community, but because we're talking about the fostering and adoption, I think in that sort of whole category of young people, the rates are a lot higher. Not just the ADHD, sometimes you see the attachment difficulties, the conduct disorder or the oppositional defiant disorders are present quite sort of at high level. But for that, that's why I was saying earlier on, we have got the services which are available. Sometimes they have those waiting list issues. But before the program, you were asking a question that can somebody foster a child who's got ADHD. Absolutely, that's not a problem. That they will get the assessment and the treatment, and then it can be managed. So it's not a contraindication for somebody to foster a child.
David, is there any support out there for children who you foster with these ADHD, and what kind of support can you give them?
Absolutely, there is, and as Ade was suggesting there, we work closely with CAMS team's colleagues, and there's a dedicated team for children who are looked after to provide professional support to other social workers who are supporting foster carers and to support the carers themselves. Obviously, it's a service which is very much in demand. I think that's probably fair to say.
Yes.
But it is important that there is tailored and dedicated support available to carers. It's important not to forget that children come into care for a range of different reasons. But a common theme is that they would have experienced some form of adverse childhood experience. Maybe they've had a degree of trauma in their lives, in their early lives. And therefore, that in itself means that, as Ali was suggesting, there's a high number of these children, requiring some additional support, and the professional network is there to support that. And alongside that, I think I mentioned earlier that if anyone's interested in becoming a carer, there's a range of training that we would expect carers to undertake, which is, as you would expect, around issues such as safeguarding children and ensuring children are provided with the right care and support. And in addition to that, there's additional training available around areas like ADHD and supporting children with some of those additional needs that they may have. So there is absolutely support there. I suppose the important part of the message here is not to forget that one of the most critical things for children to be able to thrive is for them to be able to have that stable home environment. So bringing that back to the fostering discussion this morning, it's absolutely critical that we do work together as professionals with the carers. It can be things as simple as making sure the children and young people actually get to their appointments in order to see the health professionals. Those sort of simple tasks themselves make a huge difference to a young person's chance and opportunities to be able to access the support that they need.
Yes, exactly. Abid, did you want to come in on here, because there is other issues that you deal with quite a lot in CAMS, and did you want to highlight any other issues that you've got that you think parents are struggling with?
I think in terms of that sense of awareness of the difficulties in terms of the mental health challenges that young people are facing, we've seen an exponential rise in that, starting from
COVID onwards.
Well, post-COVID, we've seen a significant increase in that number as well. We've seen a risk of self-harm, depression, anxiety disorders, obsessive-compulsive disorders, the neurodevelopmental disorders, the autism spectrum disorder and the ADHD are part of that. So those kind of issues have become quite a challenge. And as we were talking earlier on, with the big waiting list, sometimes people struggle to get those assessments done. But it's more about that awareness of those difficulties and not to try and sort of not ask for help. There is help available, and there are lots of good places of information. The LPT, the Leicestershire Partnership Trust, has got a website where there is information available for the diagnosis for ASD, ADHD, where it's explained what kind of things that can be done to sort of help smooth the process. There are things that can be done before you get the diagnosis. So there are things that you can do while you're waiting to get that assessment done as well.
We're running out of time now, but I just want to take time out to say a big thank you to Abe for coming in and all the work that you and your teams do. I know it's difficult, and I know you're under pressure all the time. There's a shortage of staff on a regular basis, but thank you very much for all you do, because I know that people in the NHS go over and beyond what they need to do and care for patients, and take the opportunity to thank all the foster carers, David, Susanna, and the service that they provide across the city, the county and the country, because they're the unsung heroes that live amongst us, that make a huge difference. I bet there's thousands of children in Leicester and Leicestershire that have gone through foster caring, and the parents that are delivering that fantastic care for them have really made a huge difference. So thank you, David. Thank you, Abe. Thank you, Susanna, for coming on today. You're listening to Radio Ramadan on 87.7 FM. I'll be back next week. We'll be talking about children's health, A&E health, that is. So we'll be talking about that next week. Hope everybody's enjoying Ramadan. We're on day 7, day 8, depending on when you started. But Ramzan Mubarak, and see you next week.